Hi there, my name is Beth Safarian and I'm a pelvic health physiotherapist at Proactive, and today I'm going to be talking to you about hormone replacement therapy, also known as HRT. So HRT is the use of medication that involves estrogen or progesterone or a combination of both. This medication is often prescribed for people who are going through perimenopause or who are postmenopausal, who are now dealing with lower production levels of estrogen and progesterone, resulting in a series of different types of symptoms. It may also be prescribed for people who are transgender, as well as people who have gone through breast cancer treatment. There are two main types of HRT that I wanted to discuss today. One is systemic and one is localized. Systemic typically has higher levels of hormones in them, and they are absorbed through either orally or through the skin, through a cream, gel, or patch, and they are traveling through your whole body, through your bloodstream. Localized HRT is absorbed through the vagina, so it's usually a pill, a cream, or a ring in which they are inserted into the vagina and absorbed through those tissues, meaning that the levels of hormones in them are quite a bit lower and they stay much more localized in those tissues, and they're not as readily absorbed into the bloodstream compared to systemic HRT. So in terms of what type of HRT would be better for what type of symptom, things like night sweats and hot flashes are usually better treated with systemic HRT versus vaginal dryness, painful intercourse, and irritation and discomfort around the vulva and vagina area. Those types of symptoms are typically better treated with a localized HRT. Okay, some of the most common localized HRTs that our clients are often prescribed include Vagifem, Premarin, and Estrogyne. So if you're someone who feels like you might benefit from HRT, the next step would be to chat with your GP about your options and see what kind of route would be best for you.